Hey, welcome to the Go-To Physio Knee Series Part 3. Now in today's episode, what we want to talk about is how to take the previous two parts, which is how to assess and identify which peripheral tissues you want to help and start to desensitize. Now I'm going to give you some tissues that I think are very important to get rid of the pain experience, but most importantly, you need to understand that that's only going to be as effective as your ability to find the true cause of the problem. So as always at the Go-To Physiotherapist Mentorship, we teach 20% of our attention is on the symptoms and the tissues contributing to the pain experience. 80% of our attention is on what we think is causing the true problem. So with a lot of knee pain patients, the ability to co-contract at the gastro, the hamstring and the glute are very, very important. So again, 80% of our time is taking a graded exposure RIA program through those, 20% through the symptoms. So with that said, let's get cracking. Let's have a look at the key tissues to desensitize to help you decrease that pain experience. So with your hands-on treatment, if you are going to influence these tissues, I mentioned already is the Vastus Lateralis. Now the Vastus Lateralis for knee pain, okay, you want to consider this bulk tissue here, okay? So if you are decreasing some protective tone, you want to work around these tissues, you think that these tissues are influencing it, all this Vastus Lateralis is going to usually come to about here. So push your heel to your bum, okay, that'll feel the hamstring, relax again, same again, okay, same again, okay, so I can feel the hamstring here, everything that way, okay, is Vastus Lateralis, okay? So when you are treating the quadriceps, and especially the Vastus Lateralis, if you're doing some hands-on treatment, I find that if we can decrease that protective tone, very often that can change the pain symptoms very quickly. But obviously we always want to ask ourselves the question, why has that gone into protective tone in the first place, okay? So the Vastus Lateralis posteriorly, I would definitely consider treating, especially if the proneflexion test had restriction, okay? So again, I'd want to make sure that we decrease any protective tone around here. Now the other tissue that's worth doing as well is the popliteus, okay, which it's quite close to the knee. So again, any protective tone, any twisting, anything like that, we may want to bring about some decreased perceived threat in these tissues. Now, when we treat this tissue, we always want to make sure then that we get the person in standing, or we give them some kind of isometric, and make sure that they're happy to put loads through these tissues. So we don't want to, I'm not a big fan of like treating a tissue and letting the person loosey-goosey, so to speak, and then going off you go, okay? If I decrease some kind of protective tone, I want to reassure the system's ability to put load and forces through that particular direction straight after it, okay? So don't like just treating it and leaving it there. But the popliteus is quite important, okay? So that comes up into the tibia here. So this kind of top fifth of the tibia, okay? So you're going to have soleus here, okay? You're going to get that oblique angle there from the soleus, and then as I go in, I'm going to dip into the popliteus here. So I'm going to have the popliteus attachment here, and even just doing some hands-on treatment here and decreasing that perceived threat, and I might even just get the athlete to do some internal and external rotations, can hopefully decrease that protective tone. Then we might start doing a little bit of work with a transverse lunge, which is going to help load and unload those tissues. So again, we just reassure. Okay, so there will be two tissues that I would particularly be focusing on with my hands-on treatment if I felt there was some protective tone that's maybe putting a bit of pressure through that knee joint, okay? And again, I'm just giving you areas that in addition to your training, okay, that may be worth focusing on, okay? So again, please don't forget the basics. Do the basics very, very well, but just consider these two parts as well. Again, the popliteus is going to go right through to the lateral side of the femur, so I'm not a big fan of going through the center of it here because of the arteries and veins. So once I stick close to the attachment here, I can usually bring through some decreased protective tone, okay? So just stripping through there, and then we might add in just some internal and external rotation, and we might just change the lengthening requirement in the sagittal plane a bit, okay? Just pop on your back, Pete. The other thing then as well is, as I get a lot of value with a lot of people with knee pain in just decreasing the protective tone around here, around the vastus lateralis, okay? So again, that vastus lateralis is we're going to knee extend. If a lot of people don't have good intent through that midfoot and they're not willing to co-contract at the knee and push through with the hamstring and the glute, I find that vastus lateralis tends to work quite hard. So just decreasing that protective tone here, then getting that person to have good intent, maybe through the midfoot or, you know, doing some kind of lunge, that can be very, very useful as well. So don't forget to treat here, vastus lateralis. It can make a big, big difference as well to your pain experience. But so once we get rid of that pain experience, that's half the battle. We need to understand why that vastus lateralis had protective tone in the first place, and then from there go about to reassure the system that it's safe for that protective tone to stay away, that the person doesn't have to tighten again. And that's the person where you're going to see where you treat them, they feel great leaving, but then they come back again and they're in pain again. So if that was the case, you know, in the second session, I wouldn't be too keen to continue to treat this unless I knew the reason why, or I thought I knew the reason why that protective tone continued to stick around in the first place. I hope that makes sense, okay? So the vastus lateralis, both here and the posterior thigh and the popliteus, are just some additional places to consider. And if we can take some protective tone away from those, usually we'll find that knee flexion improves quite nicely and kind of pain, etc., tends to die down quite nicely, okay? So consider those, but also don't forget obviously the basics and everything else you've been taught in university. So there you have it. I hope you found that useful. As always, you need to make it specific to the patient's story. And just to say one more time, please make sure that you understand what the 80% of your attention should be on, which is understanding what's causing the knee pain in the first place. These techniques and etc. are very good if we have the 80% as well. So that's only 20% of our treatment plan, which is just to get the symptoms to settle down, to allow us then to really get that graded exposure through a rock solid rehab plan. If you found this useful, I have plenty more content for you at thegotophysio.com. And as always strive to find the true cause of the patient's problem specific to their story. That's it for this week. Next week, I'll show you how to start building a change of direction plan and actually start to design the step-by-step treatment plan so that you can get lasting results for your patient and differentiate yourself as the go-to therapist. I'll see you next time.